Okay, first, we have the approval of the January 28th and the February 13th minutes. And could I get a motion, Betty, and a second? Mr. Elsasser? Any changes? All right, please vote. Oh, I voted like 6 times by accident. Oh. Member Alice, it was an aye. Okay. You got moved, or you seconded, right? Okay, so you seconded? All right. Did we look good? There we go. All right. That's our only vote because we don't have any resolutions, so we're all good now. All right, next we'll move on to informational items. First is the Board of Health. I believe Scott's going to take this one.
Yes, thank you, Mr. Chairman. Monica apologizes. She's on her way back from Springfield for a meeting that she had with the director of IDPH. But she did let me know and let the chairman know that a couple of things to report out to the committee. First, this Thursday, the health department will be presenting the status of our community health improvement plan as part of the Partnership for a Healthy Community annual meeting. They continue to work with the partner agencies and developing policies for the new Health and Human Services building starting on March 3rd. Heartland Health will begin providing care on site, and their care will be on Mondays, Tuesdays, and Thursdays, again starting the 3rd of March. Happy to take any questions back to Monica if you have any.
Any questions? Okay. Next on here is care and treatment, but they reported last month. So we'll move on to EMA. Jason?
Good afternoon. So you should have a report in front of you, so I'll just kind of recap some of that again. Presenting significant events, you'll see that we're going to maintain our relationship with state carriers. Continue to maintain that relationship with STIC. Same thing with the National Weather Service. We had some wintry weather, so they called some calls. I'm quite certain that as we move into severe weather season, we'll probably be on and off the call with the Weather Service as severe weather moves through. Meeting attendance, I continue to be a professional meeting goer, which means that I get to go out there and find out what everybody else has and the resources in our community and kind of work with them. Some trainings, standard trainings. One I'd like to point out here is specifically we participate in a physician town hall on influenza and bird flu. So we continue to, there may be something later, but we continue to monitor all sorts of emerging infectious diseases, believe it or not, but currently bird flu, most specifically. As a result, one of the things that we've had some discussions with lately, particularly right now, is that it's basically 3 partners kind of working on that. The Department of Agriculture handles everything with respect to livestock, and particularly poultry farms and things where you may have seen some issues. We're responsible for, obviously, when it comes across public health wise. So again, there's always this juggling act with respect to, we've had some conversations with PCAPs as well, just so you're aware. I think one of the hiccups that happened for us recently is I believe there was a positive goose identified in Tazewell County, and so they were collecting birds, and so then there was some miscommunication that perhaps we were. So we've opened up some communication lines with our community partners, particularly across some other counties, to ensure that we're collaborating maybe a little bit better in some situational awareness and information, specifically for H5N1 bird flu, but at some point in time, it'll be a different infectious disease we'll be communicating with. So continue to do routine exercises. Specifically, you'll see the cool thing I'd like to point out in there, two things actually, is one, we did a medical surge exercise with the hospitals. You may have paid attention or noticed in the news several weeks ago that our healthcare systems were more than strained with respect to seasonal influenza, RSV, and some other issues. And so as that occurred, they started to reach out to us as a community. Should they not have any more room inside their walls, what are we going to do and how are we going to deal with those things? We continue to have those conversations. There's, they started during the pandemic. We dealt with alternate housing and issues, but we didn't, although we made it through the pandemic and we answered some questions, we did not answer all the questions for what we're going to have to do. So that continues, and you'll notice that particularly, it's absolutely, the nomenclature's right there. Our EPI team's participating in a game almost every other week. They're participating in a pandemic game. Games have been identified by FEMA, state emergency management agencies. We've identified it that it's a great way to teach our staff how to do things and not have them sit in front of a PowerPoint or be lectured to, but actually have to make some real world decisions and have a little fun doing it. So we continue to pursue those games and activities that help our staff. Outdoor miscellaneous kind of pulls in with the outdoor warning siren. You'll see in there that we were made aware of an opportunity to collaborate with some UIC graduate students on something. So I sent them, I think, 4 or 5 different proposals. Initially, we were rejected on all 5, but then we came back to us and they offered their services to us. So we've initiated some discussions with them, most specifically on community notification across the board. And so Gretchen and I've had a little bit of discussion on it, but notification with regards to how do we reach vulnerable populations? How do we use all the tools out there to notify people, from social media to the media? What does that need to look like? Because how we communicate with our diverse communities anymore can't just be the same way we used to do it. And one of the other things along with that is our outdoor warning siren system. We've initiated discussions with them on our current system is aging, has older infrastructure, and we're looking at all sorts of different new ways, different technologies out there that may be something that we need to be considering as we move into the future with how we notify and work with our staff. Particularly with 2 areas that we're looking at quite a bit and we'll continue to, will be with our GIS. We have a great GIS department with Josh and Ian, and so we continue to look at things they can do. And I know when we mention artificial intelligence, a lot of people get a weird look or get concerned, but we're really beginning to look at what type of technology may be out there with artificial intelligence to help us be more efficient in the work we're doing. Simply as we see what's going on with respect to emergency management on a national level, we're going to recognize that we may need to be looking at how we can be more efficient here at home. So there's all sorts of tools out there. We just got to figure out which ones they are and how to use them. So.
Great. Any questions? Yes, Member Allison.
Do we have the ability to send text or phone call alerts in the event of any kind of emergency?
Yes. However, that is an opt-in system. So the public has to opt into the system we have as a county to send that information out. There is a notification through what they refer to as WAIA alerts or weather emergency alerts, and many of you probably received them. I think I received one within the last week or so regarding an Amber Alert. And so we do have the ability to send a WAIA alert to any mobile phone through the Emergency Communication Center if need be. But we would encourage, and I'm sure Gretchen, I see Strategic Communications in the room, would encourage everybody to sign up for the community's regroup, because that's just a redundant way to be sure you're going to get information from us.
Is there a way to isolate that if there was a hazmat spill, or can you break that down through GIS to people in a particular area?
Potentially. I mean, through GIS, yeah, we could probably break down and only notify a small portion of the community. It's likely that the time to do that GIS wise, it'd probably take longer than it would just to do one of our other methods. We can use our outdoor warning sirens to notify the public regarding a hazardous materials if we needed to. That's that different sound that you might hear we wouldn't use. We also have the ability on the outdoor warning sirens to speak verbally over them and communicate that way. I think they do that periodically in Mapleton, particularly when we do some testing with them, simply because of the number of hazardous materials facilities in that area. Mm-hmm.
Any other questions? All right, thank you.
Yep.
Next is the Regional Office of Education.
One of the gifts of proximity of the new facility is George has figured out where Jason's office is, and those two, we've always had a great relationship with Jason's office, but now they're doing even more things together, and the new relationships that are forging on a deeper level is really exciting to me. And speaking of the new facility, we have made ourselves right at home in the community room. Having that right there and accessible with all of the materials and the things that we need, and to be able to have people understand where that is and to tie it right into our office. We've had multiple meetings there, and we have some standing meetings that we're conducting there as well. So we have been thrilled to be able to utilize that and the conference rooms. Okay, a couple quick things. Let's see. Probably the most important one to me is that I have turned in all of my official paperwork for my retirement. So coming soon to a committee near you will be an official letter. So that might be in the packet next month, I think, because the Illinois State Board of Ed needs that from me. So that is coming. Secondly, as you know, we're moving the spring celebration of the arts to the Riverfront Museum. We have had a new situation emerge there. It's the 100th, so it's the 200th birthday of Peoria County. It's the 100th birthday of Caterpillar, and the official birthday is April 15, and they've asked us to have that be a significant piece of the spring celebration. So we are meeting with Henry Vickery's team, trying to bring in choirs, and I mean, I know there's songs about tractors, but I'm not exactly sure what all they want. And so besides, we don't want to be singing, I think he's my tractor sexy, but we'll find something. And we're very excited about that because how great. And they've asked if they can open up their facility to our guests and utilize their amphitheater. So we're going to forge that relationship as well when the spring celebration kicks off. And throughout the celebration, I want you to know we're going to, I don't know exactly because I'm not an art connoisseur, we're going to be selecting various art pieces from our students from Peoria County to display on that top wall at the new facility. So if you go up the stairs and you've got records on one side and you've got my office on the other, there's that big blank wall is going to have all kinds of art and sculpture, etc., from Peoria County students. So we're working on what that will look like, and we've got some help for that. Before I turn it over to Truancy Report, we got some really good traction on the good things that are going on with our partnership between the county and Truancy and the Regional Office of Education. So I did an interview for NPR, I did an interview for WEEK, and tomorrow I will be on Phil Luciano's radio show on WMBD tomorrow afternoon at 3:30. So with that, I will turn it over to Carol.
Okay, first I want to apologize that you don't have up-to-date data, but I had the flu when it was due, and so I was pretty down and out, so I apologize, but I do have some numbers for you. So as of February 17th, we have 742 active referrals. Very proud of my team. We have been able to exit 85 students, which means that those students have maintained an average attendance rate of 80% or more for a minimum of 8 weeks in the program. So that's really great for these students. and 85 is awesome. So I'm very, very happy about that. We've done 3,945 home slash school visits, 1,352 phone calls, text, emails. And something that we have been working on is an incentive program with Woodruff where we're hoping we can work with the barbering and hair braiding programs to use that as incentives for our students. I think Beth said it best, you know, when you have a nice fresh hairdo, you feel your best and you want to go to school. So we're working on something for that, plus just getting the kids into Woodruff so they can see those programs, hopefully incentivizing them to want to go into those programs. So that's kind of where we're at, and I promise to have more data for you next month.
I'm glad you're feeling better.
Thank you. Me too. It was terrible.
How,
It's not.
how's the little basketball boy been?
He's great. I guess I should have also said, even though those 85 students are exited, our people still check in with them, and they still provide them incentives. And because our people, of course, create connections and relationships with these students, so just because you know they're technically off their caseload, they're still checking in with them. They still maintain those relationships, so that they continue to want to come to school. So
Great. Any questions? All right. Thank you both very much.
thank you.
Next, we have sustainability. Good afternoon, Becca.
Good afternoon. I have a few updates as well, and just wanted to call attention a little bit to electronics collection. So I will start there, as it's the first thing on the agenda brief. Again, we have chosen to adopt into Consumer Electronics Recycling Act. It's something we can either opt into or opt out of. It just helps to, when we had a partnership with Kusakowski, it made them our permanent location, which was ideal because it was minimal amount of work for us, and also the fees were less, and it was a great partnership. However, Kusakowski has left the U.S., so we're sort of approaching it a number of different ways to fill that void. In 2024, they accepted 800,000 pounds of electronics just from Peoria County residents, so that's a big void to fill. Through opting into CIRA, what we are given through the IEPA and through the clearinghouse is either we were given one permanent location, then 4 one-day collections, and so that's the partnerships with, in last year it was West Peoria, Limestone, Peoria Township were our partners for one-day collections. And then we have some lined up for this year as well, some of the smaller townships. However, losing that private permanent site leaves us with the option to try to find and fill that void, find a permanent site, or to add 4 more one-day collections. So we are approaching that. We're talking to the clearinghouse and figuring out which way we can go and if we can have a little bit of leniency in this year since our recycler dropped off. I mean, it was sort of the beginning of the year, but still in the program year. So we are looking at the expansion of a private recycler to be able to pack and ship directly to the clearinghouse or through to their recycler and then to the clearinghouse. And that is a very low cost option for us, as long as there is space for them to be able to fill a semi truck. So many times that does look like a one-day collection or a weekend collection, a week-long collection to be able to fill a semi trailer with 18,000 pounds is what is required. So that you have some context, the West Peoria collection was 17,000 pounds last year, just a one-day standard annual cleanup that they do. Limestone Township was 11,000 pounds, just a 1 day, not even a full day collection. So it's definitely possible to fill those, in a 1 day collection. But losing the ability to have the permanent site is tricky. So my preference is to try to find a permanent site, but in the meantime, we'll sort of be piecing it together as best we can. And if there are 1 day collections, I will certainly make that well known, so that we can collect as much as possible. But the idea is to try to expand private recycling, or to help a private recycler be able to expand to be our permanent location. And maybe a township, or maybe, a municipality is willing to accept. There's a lot of different ways to approach it. Just we have to fill a semi-trailer, otherwise there are fees. Can't send a half a truck. So that's electronics recycling. Household hazardous waste, very, very close. Within a day or two, we'll know for sure whether or not we have one. We have 2 dates that we're narrowed down to, and the IEPA really wants to have one here since we missed last spring because they didn't have a contract. Education remains the same. Recycle Coach is nearly ready to launch, so I hope to be able to bring that to you soon, at least the beta launch of that. Township Supervisors Group does meet on April 16th at Health and Human Services. We have 2 speakers that day. GIS is our county speaker, and then we also did invite GFL to talk a little bit about the hazardous waste collections, which will include electronics and they've identified 3 different dates, still tentative based on when the landfill closes, but they're out far enough in the year that I think that they will be permanent actual dates. Working with Gretchen, we have already have a draft flyer, have had it for a while, for handing out at the landfill for social media and for the website in terms of what people will do when the landfill closes and where they can take their garbage. So we will be finishing that up this week. Regional Food Council, the location was to be determined. It is actually Distillery Labs on April 4th, if anyone would like to join us. And then the sustainability update, I chuckled about Truancy having the flu because same situation. The report of utility usage is not as robust as I would like or what you're used to seeing, so I can include more, and then I'll just include some verbally. It was really high level. So therms overall for all buildings up 2.6%, 2024 over 23. The last 2 months are really when it was you see the largest impact in November and December, with HHS really sort of ramping up a bit. I mean, obviously there was usage throughout the year, but November and December was the biggest uptick. What else did I want to report? The coroner, I looked at January usage for the coroner, keeping in mind they only moved halfway through the month in January, and they were down 12% January 24 compared to 2025, or 25 compared to 24. For electric usage, you see that it's up 8%. HHS is online, and the coroner's office had not moved yet. I can pull out a few other buildings to show you next month as well, if you'd like, but I'm happy to answer any questions at this point.
Thank you. Just quickly, do we have a resource anywhere for some of the other locations that accept recycling materials?
We do. So I have a table of what is accepted and some of the information. My intern was finishing that up, and we'll get that posted for sure tomorrow. So televisions are the biggest concern. Best Buy does accept televisions, their own brand, Insignia and Dynex, for free, 50 inches or smaller. I'm telling you all this, I don't know if you'll remember, but it will be posted on the website tomorrow. And then it's $30 or $29.99 actually for other brands, with CRTs 31 inches or less and LCDs 50 inches or less. eCycle is on 8,000 or 8,900 industrial, and they do accept LCDs up to 70 inches and CRTs up to 23 inches, $20 for each of those. Computers and peripherals can go to any of the places. Goodwill is entirely free. It doesn't matter if it's a CRT or LED. eCycle charges $5 for monitors. Batteries are accepted and small appliances are also accepted in e-cycle, which is something similar to Kusakowski. And they also accept lithium ion batteries, not just in laptops, but separate, and lead acid batteries. So they have a little bit more of a robust list of items that they do accept. And included in that will be the website for all three of those locations, but those are really our three main partners for electronics collection.
Great, thank you for that. And then if we do get approval for household waste pickup, I know one of the biggest challenges the BEC has is volunteers to help direct traffic. So if that happens, if anybody's available, I promise to be available as long as I'm not taking a kid to college at that time. But
Yeah, it's a really easy gig. You just got to wear sunscreen
sure.
or wear a poncho, depending.
And then lastly, I know you mentioned there was an uptick in usage and some of it is attributed to HHS. There have been some discussions and we hope to eventually get some panels on top of that roof since it was built for panels. So that's something we'll be talking about here soon. And does anybody have any other questions for Becca? Okay, thank you very much. Next, exciting. Speaking of HHS, it's the building financials update.
Good afternoon. I apologize. For those of you that heard this yesterday, I'm sure that you would not mind hearing the good news again, though. So, I do not have a rooster joining us today. I apologize for that. I actually joked about finding sounds to pipe through, but I didn't have time. So, it was entertaining for sure. So at Member Rulin's request, we're providing an update on the financials to date for the Health and Human Services building. Obviously, the building is currently being utilized, and there are still some invoices outstanding, including the final pay app and retainage due to River City. But these are the almost final financials through February 20th. So just keep that in mind. That number will change a little bit, but we don't anticipate it changing significantly. So I just want to say, due to the prudence of the leadership team involved in the project, we are really excited to report the project not only finished 1 month early, which is rarely heard of in a construction project of this size, but it is also well on track to be well under budget. Yeah. Applause, please. Just kidding. Okay, so this table shows the various funding sources that were approved by the board. The total project budget was $22.9 million. And just going down the table, the initial funding of $22.3 million was approved at the April 2023 board meeting. The health department funding is comprised of $4.95 million, of which $4.7 million was due to reserves that they intentionally built up in their fund reserve balance to put toward a project like this, plus $250,000 from the Solid Waste Management Fund that was transferred from the Solid Waste Management Fund to the Health Department Fund. That's why it's included in that line. I just wanted to highlight that. The next funding source, obviously, is the American Rescue Plan Act funds, $16.6 million. The General Fund and Capital Projects Fund split $500,000 approved budget for that. And then the Solid Waste Management Fund, an additional $250,000, so a total of $500,000 from the Solid Waste Management Fund. Then in May of 2024, the board approved again another funding source from the Information Technology Services Fund to cover all of those IT-related expenses in the amount of about $584,000 for the total $22.9 million budget. Paid to date is about $20.7 million. We have another $1.4 million in either open purchase orders or pending expenses we know are coming, and that includes $1.3 million in retainage to River City. And that leaves us a remaining balance of $783,000 at this moment. So, very good numbers. About 3.4% of the entire budget. This next table shows us how it's broken down by category of the project. So the first 4 lines in the table are the total GMP, or guaranteed maximum price, expenses, and that is the contract with River City Construction. And of that 18.7 million, we have 107,000 in allowances and contingencies that have not yet been designated. And then in the non-GMP soft costs, those are things such as design, furniture, fixtures, equipment, material testing, utility connection. There was a total budget of $3.67 million, and we have a remaining balance available of about $540,000. And then the IT-related costs, we have about $136,000 left in that particular line item, and that was used to purchase servers, laptops, monitors, all security equipment, that type of thing within the facility. Finally, I just want to reiterate the early completion. And then there were value-added enhancements to the building included in the construction costs that were originally removed to do the value engineering. But these 4 items were put in because they really do add value to the building. And specifically in the sidewalk snow melt system, it will help us save on operational costs going forward as well. The community room partition now allows it to be 2 functional spaces instead of just 1, which Beth Kreider had alluded to earlier, that it's a really great space to use. And then the north parking lot and the rooftop patio were also value-add enhancements. So I just want to open it up to any questions that you may have, and anything I can't answer, I am sure Administrator Sorrell or Member Ruland can help out with.
Thank you. I think also the sidewalk snow melt system is also a liability, could save us from potential liability issues. Somebody should happen to get hurt. So this is very exciting. Thank you for the report, and thank you, Member Ruland, for asking for this report. And actually for Scott, Monica, and Terry, thank you for looking out for the taxpayers and making sure that our money is well spent. If anybody's been, hopefully everybody's been over to the facility at this point, but walking through the facility, it's a nice facility. It wasn't done cheaply, but yet we still saved $700,000, so I appreciate that. Member Blair.
Question for Heather. Since we saved money, how does that affect ARPA since we need to spend that money? Does it go to something else?
That's a great question. So currently there's about $227,000 in the ARPA line that was dedicated to this project that has not been spent. And at the end of last year, we internally over-obligated ARPA with the additional construction management contracts with Core and PJ Hare. And so that any funds that are not used on this are allowed to roll to fund that project or any other similar projects.
Good question. Any other questions? Yes, Member Ricker.
Just for clarification, did the community kitchen, as part of the community room, did all of that get finished? Because at one time we talked about not investing the complete kitchen update or the kitchen build out. Is that done? Is there anything that we left undone that we should be looking at?
I'll let Terry answer.
I would say no. I think the kitchen is very complete. It's a large kitchen, so there is room if the health department and the people who utilize that find a need for something different. They would be, they'd be able to add more equipment in the future, but it's a complete and operational kitchen, not only for the purposes of the meeting rooms and events that might be held there, but for training restaurant staffs that are involved in licensing for new facilities.
Good question. Any other questions?
If I could,
Yeah.
I'm not on this committee, so I don't want to overstep my bounds, but in the breakdown of these savings, it's pretty clear that some of that came from IT. I think an argument could be made, and I think we'd have to defer to Heather in terms of ARPA or not ARPA. But looking at the line items that are under budget, I think you may have, at least from my curiosity, you may be able to move that money back into various budgets that would not be subject to ARPA controls. I don't know that to be true, but we do know where the savings came from, and some of those were not ARPA funds specifically, IT as an example, but there may be more. So to piggyback on the question of whether it goes back to our ARPA pool and into those projects only, I'd have to get some more input myself on whether or not that's something that we can work with.
I had similar questions, so we're on the same page. Any other questions, comments? Okay. Thank you, Heather. Next is the quarterly strategic plan update.
Mr. Chairman, you'll find that at the end of the packet. Happy to answer any questions about the specifics that are in the quarterly report. But as I've done at each committee meeting, I'd like to take this opportunity just to remind everyone of the strategic planning retreat on the morning of Saturday, March 22nd. We're still finalizing a location, so as soon as we have that, we'll update the meeting request for all of you. And know that the rough outline of the agenda for Saturday the 22nd is that we'll review what's in this work plan and those items that are complete and where we can check the box. We'll do that and celebrate those successes, and then Chairman Dillon and I are going to facilitate a discussion about what things should be added to the work plan. Happy to answer any questions.
All right, any questions? Okay, thank you. Any public comment? All right, we're adjourned. Thank you.